Hey guys, I'm Dr. Josh Jagoda, and if you've been recently diagnosed with degenerative disc disease or DDD, then you probably are going to want to stick in with this episode because degenerative disc disease is essentially a condition where a lot of physicians will just kind of label you based off of your x-ray or MRI and saying essentially what they're saying is that the surfaces of the bone are coming together. So if you look in the spine, we have two surfaces here, two bones here. Well, we have a bunch of bones, but more specifically, we're talking about bone on top of bone. But in between each bone, what we're going to notice is there a disc. And when the disc starts to dehydrate, it gets compressed. The two surfaces come together. And a lot of people will say that you have degenerative disc disease. And maybe that's why you're having pain in a certain area. But research-wise, we're talking about, there is not much correlation within structure as much as there is with pain and the structure itself. So that really just means that when somebody says you have degenerative disc disease, that your structure or what you have going on with your spine does not always correlate with pain. So that's really a first thing to be really, really important, because a lot of physicians will say this is what you have, this is what's going on with you, but it doesn't always correlate with pain. Also, let's just keep in mind that there's so many people out there that if we x-ray or MRI most people, you're probably going to find some sort of dysfunction within each disc. So if you MRI myself, I MRI you, and we find the same problem, we might have pain with myself, but we might have no pain with you. Or likewise, we might have pain with both people, but that doesn't always correlate. So if you're having degenerative disc disease, guys, I really speak loudly about this. It's just a diagnosis. It does not determine exactly how you function. And if you MRI a lot of people out there, you're going to find some of the same issues. And a lot of reasons I talk about this is because when you get diagnosed with this, it can be frustrating. I have a lot of people call up and say, this is what I have going on. And at the same time, it doesn't necessarily matter. It doesn't predict if you're going to get better or not. And a lot of times you can just get better on your own with continuing to have this type of, quote, disease. It's not necessarily a disease, guys. It is a normal process of wear and tear. It's just the matter of a fact is, are you painful? Can you function? Can you do what you want to do or not? If you can't do those activities, guys, then that's an issue. But if you have degenerative disc disease and you are pain-free, you're healthy, you're doing activity, you're having a good time in life, then it's not really that big of an issue. So overall, guys, if you've just been recently diagnosed with degenerative disc disease from an x-ray or an MRI, don't freak out. There's not much correlation with it. You can heal, you can feel well, you can function well, and you can live a normal, healthy life. So don't believe that disease, and just know that this is definitely treatable, manageable, and it really just takes a little bit of fine-tuning with regard to your program, your efforts, your exercises, who you see, and what you believe in. All right, guys? My name is Dr. Josh Jagoda. Thanks for stopping by, and don't forget to subscribe to our channel. I'll see you guys for the next episode. Take care, guys.